So we are going to talk about the bicarb here. So what happens in renal failure? In renal failure, the bicarbonate which should normally be absorbed by the kidneys is not absorbed. Therefore, the bicarbonate decreases. So any change with respect to bicarbonate, we call it as metabolic. Any change with respect to the respiratory gases, we call it as respiratory, isn't it? So if the bicarbonate respiratory, if the when there is a change in the carbon dioxide. So in metabolic, it depends upon the bicarbonate. So when the bicarbonate is high, it is called as alkalosis, but when the bicarbonate is low, it is the acidosis. So the decrease of the bicarbonate, like the bicarbonate is being excreted in the urine in renal failure. So therefore, in renal failure patients, they will be having a metabolic acidosis. If we go into detail of metabolic acidosis, there is a metabolic acidosis. There are two types of metabolic acidosis. One is the high anion gap metabolic acidosis, and the other is the normal anion gap metabolic acidosis. I will go into detail little in the forthcoming videos, but just remember there is a mnemonic to remember the causes of the high anionic gap metabolic acidosis. That mnemonic is mud piles. So the U in high anionic gap metabolic acidosis stands for uremia, and that is because of this reason, that is the bicarbonate is being released. It causes metabolic acidosis, which is high anionic gap metabolic acidosis, which is one of the reason of high anionic gap metabolic acidosis, and U, and it stands for the full form of this U, mud piles. Thank you for listening. Have a good day.